Hello guys, I welcome you all for my YouTube channel. Here Brinda. Today in this video we'll get information based on one of the topic of microbiology, that is opportunistic mycotic infections. So let's get into the topic. As we all know that there are diverse group of fungi that live on the dead and decaying matter and do not cause any harm. However, under certain conditions, these fungi, that is, useful fungi, also cause different infections. Such infections are called as opportunistic infections. Here there are some of the examples for organism causing opportunistic infections. They are Aspergillus, Penicillium, Zychomycetes, Fusarium, and so on. First one is Aspergillus. There are more than 300 species in this Aspergillus family. Among those 300 species, Aspergillus fumigatus is the main opportunistic pathogen that causes disease. It includes other species also. They are Aspergillus flavus, Aspergillus niger, Aspergillus terras, Aspergillus nidulans. This organism causes the clinical condition aspergillosis. This infection occurs mainly because of the reason that the inhalation of the spores of the Aspergillus. Causes includes respiratory diseases, disseminated or invasive aspergillosis, superficial infections. Respiratory diseases includes Aspergillus asthma, frequently seen in hypersensitive patients. Second one is bronchopulmonary aspergillus. It is a condition in which the fungi grow in the lumen and bronchioles. And the third one is aspergillioma. It is also called as intracavity aspergillioma or fungus ball. In this condition, the fungi produce colonies in the pre-existing cavities of the lungs. Disseminated or invasive aspergillosis is a condition where it results due to the hematogenous spread. The fungi first causes pneumonia and then causes infection to other organs like brain, kidney and eye. Some of the superficial infections include mycotic keratitis and otomycosis. So it can be diagnosed by following methods. First one is direct microscopy. Under KYH preparations, the specimen shows non-pigmented septate mycelium. Second, by culturing. The specimen is inoculated into the SDA medium, that is a type of agar medium with chloramphenicol at 25 degrees Celsius for 1 to 4 days. The grey colony formation will be absorbed with the powdery surface. It can be cured by treating a person with amphotericin B, which is the effective drug for this disease. In the following figure, we can able to observe that how it affects. And the next disease is caused by a fungi penicillium. We all know that how important the penicillium is and how much it plays an important role in our day-to-day life. But this penicillium also causes some of the infections during unfavorable conditions. And these infection includes penicilliosis, otomycosis and mycotic keratitis. First, penicilliosis. Penicilliosis is an infection caused by the Penicillium marneae. It is a dimorphic fungi. Symptoms of penicilliosis includes bumps on the skin are common symptom. These bumps are usually small and painless. The bumps usually appear on the face and neck but also appear in other places of the body. There are other symptoms also, which includes fever, general discomfort, weight loss, cough, swollen lymph nodes, difficulty in breathing, swelling of the liver and spleen, diarrhea and abdominal pain. Penicilliosis usually affects people living with HIV differently than people who do not have HIV. In people with HIV, penicilliosis is more likely to spread through the blood and affect the whole body. In people who do not have HIV, penicilliosis commonly affects the lungs, liver, mouth, although sometimes it spreads through the blood and affects the whole body. In people with HIV, skin bumps due to penicilliosis usually have a small dent in the center. In people who do not have HIV, these bumps are more likely to appear smooth. Penicillosis is also more likely to cause fever and swelling of the spleen in people who have HIV. This fungus can make people sick in weeks to years after they come in contact with it. So, penicillosis can also be cured. It can be cured by treating a person with antifungal medicines. The most common treatment is amphotericin B given through a vein for 2 weeks, followed by intracanazonal given by mouth for 10 weeks. Other antifungal medicines that can be used include intracanazonal by itself or voriconazole. In the following figure, we can able to observe that how bumps are produced due to penicillosis. And this is a penicillosis causing organism, Penicillium. The next group of fungi which causes infection is zygomycetes. They are of 3 types, that is Rhizopus, Mucor, Absida. They usually produce different types of infections due to the inhalation of the spores in the air and dust. The infection produced by this organism is zygomycosis, which includes mucormycosis that originates in the nose and paranasal sinuses. Symptoms usually include low-grade fever, red and necrotized nasal tissues, pain in the sinus, and thin bloody discharge. Other diseases produced by the zygomycetes are: first one, gastrointestinal mucormycosis. Infection may occur from the environment and causes diarrheal, malnutritional, and uremial disease. Second one is pulmonary mucormycosis. It is a form of severe pneumonia which is associated with fever and toxicity. It can also be diagnosed by 2 methods. First one is direct microscopy. Under KOH preparations, it shows the presence of spores. And in the culturing method, the specimen is inoculated in a SDA medium. That is, we already know that SDA is a type of agar medium, and incubated at 25 degrees Celsius for 1 to 3 days. And the same way, the colony formation will be occurred. It can be cured by treating a person with amphotericin B, which is a drug against the zygomycetes. In the following figure, we can able to observe that how it affects. Following is a zygomycetes causing organism. The next infection is caused by the fungi Fusarium. The infection with Fusarium are associated with keratitis, otomycosis, and nail infection. Symptoms may include vascular wilt, root rot, foot and stem rot, leaf lessons, fruit rot, head blight in cereals, and post-harvest decay. Fusarium oxysporum is the species causing vascular wilt. First, the leaves turn yellow and wilt, mostly on one side of the plant. Finally, the whole plant wilts. To protect the emerging seedlings from the infection, we can treat the seed with fungicides or we can heat them. We can also dip bulbs and combs in fungicides or hot water to reduce Fusarium. They can also be diagnosed under microscope with KOH preparations and culturing in the SDA medium. In the following figure, we can able to observe that how it affects. And the next disease is torulopsis. It causes the infection in the skin and the nail, where the nail becomes dark in color. The fungi also causes foot infection. We can diagnose them by treating with SDA culture, where it shows the formation of grey black colored colonies. Following is the organism that causes torulopsis. And the next disease is acremonium. Acremonium falciforme or Cephalosporium falciforme is responsible for causing mycotic keratitis and occasionally arthritis and systematic diseases. Symptoms may include arthritis, osteomyelitis, peritonitis, endocarditis, pneumonia, cerebritis, and subcutaneous infections. And also, based on the anecdotal reports, treatment of most invasive acremonium infections requires a combination of surgical interventions, when possible, and a regeninium of amphotericin B. Some azoles also display inhibitory activity. Also be diagnosed by microscopic method and cultural method. Following is the organism that cause acremonium. The next disease is scopuloryopsis. Scopolioriopsis is an etiological agent responsible for 5% of fungal infections and may cause mycotic keratitis and bronchopulmonary disease. Its symptoms may include onychomycosis, keratitis, invasive sinusitis, and prosthetic valve endocarditis. And treatment with the oral agents was the best method to cure them. Those oral agents are Griseofluvin 600 mg twice daily for 12 months, ketoconazole 200 mg daily for 4 months, Terina-fine 250 mg daily for 12 weeks, and fluconazole 150 mg per day for 12 weeks. It can also be diagnosed by microscopic studies and cultural studies. In the following figure, we can able to observe the mass of hypha which cause scopolioriopsis. So finally, I thank you for watching my video, hoping that you gained a little more information.